Hi, Kevin Henry, the Group Editorial Director for Advanstar and Modern Hygienist, and I'm on a Google Hangout today with my friend and America's dental hygienist, Anastasia Turchetta. Hey, Anastasia, what's going on?
Hey Kevin, not too much. Just excited to talk about whitening.
Well, good, because that's what we're going to talk about. This works out perfectly. So, talk to me about whitening in the dental practice. If I'm a patient and you're talking to me about in-office whitening, in my head I'm thinking, well, can't I just go to Walmart or Walgreens and get something that works just as good? How do you convince me as a patient that in-office is much better than what they can get down the street at a convenience store?
That actually is like the big question because everybody wants whiter teeth. One, we know it makes us look younger. Two, it makes you feel more confident. But here's what I find: if you're going to talk to a patient about it, especially in today's dental field, the hygienist really is responsible for getting the facts. You just can't walk in and have a patient, say, I just want, whitening and expect them to buy in, so to speak. So what are the facts? And the facts would be like, what's their current state of oral health? What's their lifestyle? Do they have, do they smoke cigarettes or, anything like that? Drink coffee? What medications are they on? What's their age? What dental work have they had done? Do they have periodontal disease? I mean, there's a lot of stuff that goes into it that people don't realize. So you have to get the facts out first before you begin anything. Because a lot of people just seem to think, well, hey, I will just go to Walmart and have my teeth whitened. When, they're going to not get the results that they originally sought after.
My daughter just turned 16, and she actually, a lot of her friends did whitening when they were pretty young. I mean, it's one of those things that we're in a society now where looks matter, and especially to adolescent girls. Is there a certain age where you say you're just too young to whiten, and how do you talk to them about that?
That's the other thing too. When you think about it, like especially for orthodontics, because I'm sure Julia and some of her friends, it's one of those things where everybody gets done with white or their ortho treatment, and like the first thing is let's get them whitened. I'm not a fan of that, and I'm not a fan of under the age of 16. And the reason is you almost get into this phase of could you over whiten? Who's monitoring? Again, looking at the current state of oral health, a lot of these kids or teens have decalcification where the enamel is weak. Well, that doesn't make sense in our world. So you have some weak enamel. Let's just throw you out into the abyss, and let's just slap on a gel that's going to, whiten them, but yet not strengthen the area where the enamel is weak. I just see a lot of problems down the line with that. So I would not recommend for under the age of 16. And a lot of the products out there do the same thing. It's the parents we got to tell, because the kids aren't going to tell you. They're going to want the white teeth.
Oh,
So,
absolutely.
most
Yeah.
parents are going to think, oh, it's just a strip, I can place it on there. And, you got to monitor that. What's their caries risk? Again, what's their oral hygiene like? If they have good oral hygiene, then, at the age of 16, I would discuss it with them for sure.
Well, and one thing it's kind of like you just mentioned a minute ago is that you don't know what dental problems you might have if you're just going down the street and getting the strips or whatever it might be, and yet under your guidance as a hygienist, things can go much more smoothly, especially with sensitivity and things like that, right?
Exactly, exactly. And when you're looking at what is over the counter and what isn't, it's amazing to me how certain products they've expanded. So the verbiage is used a little bit differently. So sometimes it'll say, well, click here if you want to use a more, basically to save money. Click here if you want the fastest whitening smile. Click here if you want a glamour smile. And I'm like, okay, why are we not addressing that? So, if you're talking about something like strips, opalescence, made by Ultradent, they have preloaded trays, but their trays, they're called the Opalescence Go, and they come in 2 different percentages, which I like. So we're able to discuss that with them. So, your patient's either using 10% or 15% hydrogen peroxide. It comes in a couple of different flavors, but Kevin, the deal is it's got potassium nitrate and fluoride in it. We can monitor for sensitivity. And this particular tray, the new one especially, it's aligned more with your mouth, so it'd be great for patients that either have straighter teeth or came out of ortho, anything like that, and it addresses sensitivity. If you're doing in-office, then Zoom with the Relief Gel, it's the only one with ACP in it. That's also helpful for remineralization. And I think that's where the professionals separate from the over-the-counter. We have remineralization products where they don't, and the patient doesn't know. There's risks for whitening.
Real quick, Anastasia, just want to ask you, I mean, obviously, practicing hygienist, have you been in a practice where you've really seen they have it down as far as making sure the whitening is actually a profit center in the practice? Have you seen somewhere like that, and what advice would you give on really boosting that up in the practice?
Yes, I have, and I've seen it actually in two different ways. I've seen it where myself is what my responsibilities were in taking the impressions and giving the patient the trays, and then of course educating them once the trays came back because we made them in office, and that was a part of my routine. So literally that's offered to every single patient and addressed. And then the other way we practiced it was literally through assisted hygiene. So the hygiene assistant could either help out with the impressions, and then finally too, you have that time set aside for Zoom or something in office. If you're using a laser technique, only using like 45 minutes and you're about 8 shades whiter. So how is that a profit center? You're almost buffering that time like you would scaling and root planing. So you're going to need a separate time for that patient to come in because most offices aren't going to allow that.
Okay.
I'm not saying 2 times a day, but maybe once a week have that little buffer time so you might have somebody invest in it and they can get it done right then and there.
No, it's great thought, and certainly that's something that will coordinate between the back office and the front office to make sure that buffer time is built in.
Definitely. You have somebody who wants that service right then, we better deliver it.
Gotcha. Anastasia, as always, great thoughts and great ideas to pass along to our viewers. I really do appreciate the time. Thanks.
Thank you for your time, Kevin.